Well, the doctor who first raised the alarm about the variant in South Africa says Omicron is now presenting as a mild disease with very few increases in hospitalisations, despite the fact South Africa has much lower vaccination rates than the UK. Well, Dr. Angelique Coetzee joins us now from Pretoria. Thank you very much for joining us. It presents as a mild disease. I mean, that's positive, particularly when we look at the papers here in the UK. All the front pages are about the concerns of this Omicron variant and the booster jab. But is it fair to say that the South African population is younger and that's why it's presenting milder, and here we actually could get it a lot worse?
Good morning. The answer is not as easy as that, or as simple as that. So, yes, we do have a lot of younger population, but we also have quite a sick older population. So our patients above the age of 50, between 50 and 60 and older, it's got quite a huge lot of comorbidities, or a high load of comorbidities. So diabetes, hypertension, and hypercholesterolemi is one of the commonest symptoms that we have, and South Africa also has a high increase in TB as well as HIV. So yes, we can say you have a more older population than we have, but also our younger population are not that much vaccinated. Not many of them are vaccinated at the same scale than our population above the age of 60. So currently more than 65% above the age of 60 has been vaccinated, and we will start with the booster vaccines within the next week or two.
Yeah, I mentioned in the introduction to you that the high case numbers aren't translating into hospital admissions. What's the situation with hospitalisations right now in South Africa?
So thank you for that question, because I think that is where everyone is looking at for those data. Currently, we have a policy: if you are admitted in hospital, you will be tested for COVID. So unfortunately, these cases are also being registered as COVID cases, but they're not there primarily for COVID. So most of them are there for other diseases, and then COVID would be, or Omicron would be, incidentally detected. However, there are in the ICUs a few patients with only COVID related. We're not sure whether that's Omicron or Delta at this stage. But again, we have other patients also in ICU for other reasons. And again, Omicron or let me rather put it, COVID then detected, but that's not the primary reason. So the primary patients admitted for Omicron or Delta are the minimum. It's not the majority. And if you look at our cases, yesterday there was a backlog published. And if you look at our cases yesterday, it seems as if we had 39,000 positive cases. No, we only had 18,000, but less people tested yesterday. So about 60,000 people tested yesterday, and therefore the infectivity rate is 28%. But again, it's mild. Even our president got COVID, and I'm quite sure that he will also have a mild disease. And it's not of concern, the mild symptoms. And we haven't seen those mild symptoms yet going into severe disease.
Yeah, so we are bracing ourselves for a wave. I mean, the London School of Hygiene and Tropical Medicine have warned of a substantial wave of Omicron cases. South Africa hasn't gone into lockdown in response to Omicron. Should we be worried here?
Yeah, you have to watch it. And yes, you will have a significant increase in your cases. Remember, we see breakthrough infections, regardless whether you've been vaccinated previously, had COVID, or COVID and vaccinated or unvaccinated. So yes, you will have an increase. That's a given. But your healthcare system should be able to detect it very easily to try and treat these patients, send them home, get them tested as much as possible, track and trace the people or the contacts around them. And then, the question that you also would need to answer is, would it be mild COVID turning into severe COVID in 2 or 3 weeks after they have contracted it? And then what type of patient is lying in your ICU? For now, we don't see that. We don't see people getting a cytokine storm from mild disease.
OK, South Africa is further down the Omicron road than us, so it's really interesting to get your insight. Dr. Angelique Coetzee, thank you very much indeed for joining us.